Hello, and welcome to this special GIS feature where today we will be speaking about pharmaceuticals and what we all need to know. There's so much to talk about that we have to break this program into 4 parts. In part 1, we will be speaking about asthma and asthma management. So if you're an asthmatic or a caregiver of someone who has asthma, this is a program you definitely don't want to miss. We have with us Mrs. Gracia Wheatley-Smith, Chief of Drugs and Pharmaceuticals. Thank you for joining us, Ms. Smith.
Thank you for having me. Thank you for having me, Ms. Letsom.
No problem. Now, to get us all started, tell us what exactly is asthma and what do we need to know about this disease?
Asthma is a condition that affects the lungs. It's chronic, it's long-term, and it causes inflammation and also narrowing of the airways with your bronchioles. It's very serious because it is wheezing, so it causes wheezing. So you cannot get the air out of your lungs. So you imagine you cannot get air in and you cannot get air out because your lungs, your airways are swollen. And you know, of course, that breathing is your lifeline. Right. So it's very, very serious. It's also characterized by not only wheezing, but tightness in your chest, shortness of breath, because like I said, you cannot breathe. And also there's a cough that occurs in the night or in the early morning. So it's a very serious condition that we need to take consideration of.
Okay. And how exactly would one get asthma? Is this a genetic thing or how do you get asthma?
Asthma is inherited from parents who had asthma to children, or it can occur due to your occupation. So that is what we call occupational asthma, where you're constantly being exposed to chemicals, whether you're a nurse or you're a cleaner, and the chemicals cause your airways to become sensitive. And so you can develop occupational asthma. We've had nurses who, because of the chemicals we use to clean the hospitals, have had to leave those jobs and find jobs elsewhere. We've had cleaners who have had to stop that job because the chemicals were causing asthmatic attacks.
So for persons who may develop asthma due to their occupation, is there anything that they could do to help reduce their vulnerability?
Well, I guess the employers would have to look at the line of chemicals that they're using to see if they can get some that are milder, if that is what is triggering the asthma attack, or they may need to search for another job where they are not exposed to chemicals.
Okay. Now, I understand that we had 3 patient-friendly asthma management workshops earlier this year. What inspired those workshops, and what exactly is patient-friendly? What does that mean?
Well, what inspired the workshops is that I found that some children who were asthmatics were not taking their inhalers to school. And therefore, if those children got an asthma attack in school, time is of the essence. If the nurse at the school didn't have one to administer the salbutamol, which is what we call the reliever inhaler, to stop the spasms in the airways, then that child can enter into a crisis. So I wanted the parents to know that they need to send the inhaler with the children to school. And we also wanted to demonstrate to the children how to properly use the inhaler. So when they're away from the parents, they can properly administer the inhaler. And also the nurses and the caregivers of children in our daycare centers, because children, babies also do get asthma. Yes.
Now, as a parent or caregiver for someone who has asthma, or as an asthmatic themselves, what are some of the signs and the symptoms should they be looking out for of possible triggers or attacks?
The attacks would be, like I said, wheezing. It is where there's a sound that is made because you're trying to get air in and out, so it's like a whistling sound. And if you see someone holding their chest, they're having trouble breathing. If you hear a child coughing constantly in their sleep at night or in the early morning, you need to look for that sign also as well.
Now, what are some possible triggers?
The triggers we have can be like tobacco smoke. Okay, can be the dust mite. You know those little things that are in our beds? Yes, those little animals, cockroaches, their droppings, strong perfumes, cold weather can also cause the bronchioles to go in spasms. Chemicals can also bring on an asthma attack. Yes, so those are some of the triggers. Our little furry animals that we like to have, or dogs that have so much fur, even the teddy bears that our children like to keep in their beds for decorative purposes. Those can also trigger an attack because the dust mites will hide in them. Dust can collect in them and can irritate.
Now, as you mentioned earlier, you spoke in terms of time and preventing that crisis mode from an individual who may have an asthma attack or experiencing an asthma attack. For persons who have identified the signs and the triggers and possibly is aware of that, okay, their child or they may be experiencing an asthma attack, what should they do?
Well, I am hoping, I would be praying that that child has already had the inhalers to take. So there's the blue one, or the salbutamol, or what we call the reliever inhaler. So when that one is taken, when you're actually in an active asthma attack, it calms the bronchioles in your lungs, right? And it stops the spasm. So you're able to breathe quite quickly back to normal. And then there's also another inhaler, which we called the preventer, Becotide. It's usually brown as hair. And what that does is it treats the inflammation and the narrowing of the airway. So when you use the two, the blue one or the salbutamol or the reliever for the instant attack, you can get yourself calm and back to normal breathing. And then the brown one or the Becotide or the steroid that treats the inflammation and the narrowing of the airways is to be used twice a day, in the morning and in the evening. And that would help prevent, unless there is a trigger factor that comes into play. So the blue one, the salbutamol or the reliever, is used when necessary. But if you have to use it more than 4 to 6 times a day, you need to check your physician and to see if there is something you can do to control your asthma.
Now, at what point should they be seeking external help?
If they have to use the reliever inhaler more than 4 to 6 times a day within 24 hours, they need to be seeking help. If they are using it and not getting any relief in breathing, they need to go to the hospital and seek help, yes.
Now, in terms of babies, I know you're speaking about, young children, but in terms of babies, what interventions or what should we know about asthma and young babies?
Well, it's quite difficult. I guess the only way you would notice if you see the baby in a breathing crisis. But they use the same inhalers as the adult, and we would need to use a spacer device. Because in using the inhalers, you have to coordinate the pressing of the inhaler with inhaling the propellant so that it can get into your airways. So with babies, seeing that we cannot do that, we have to use what is called a spacer. It's a device that you would put over the nose and the mouth, and you press, and the baby would be able to breathe.
Okay. Now, an important part of asthma management is knowing how to properly use these devices. Now, I see here that we have a number of devices that you have here associated with asthma and asthma management. Can you just tell us a bit about what we have here and how it fits into the whole asthma management strategy?
Okay. This one is the Becotide inhaler. As you see, it is brown. So it is the preventer. It is a mild steroid, not the steroid that builds muscles. So we don't have to be afraid. I know a lot of individuals are saying a steroid, and that is why they don't use it. But it helps to prevent the attacks. So it should be used. So this is the inhaler. An adult, as you see, can do this. You would shake it first. And when you press the propellant in your mouth, you can breathe. However, we notice sometimes that individuals are a bit challenged, especially our elderly population with arthritis in their hand. So this one is a spacer. As you see, it has the mask and it has the body. So we have here where our inhaler can go in. We can put on our mask. And then after we can press. Remember, it was shaking already, and we can press. So what happens is that the medicine is held in this chamber. And all the patient has to do is place it on their nose, take about 10 breaths in between. Press again, because it's usually 2 puffs, and then breathe. It is equipped with a flow valve that would not allow the medicine to flow out until you breathe. Now, if you breathe too fast for the medicine to work, you will hear a whistle, and that would tell you that you need to slow down in your breathing. But this would assist. This is an adult size mask. Then we have masks for children's size to accommodate the face, because you do not want it escaping. And then we have masks for the babies. So even babies we think about in the treatment of asthma, because time is of the essence. Also now, what we have here by you is the peak flow meter. And the peak flow meter is kind of like our stop sign, our stop lights that we have that tell us green, go, amber, slow down, red, you must stop. So all we have to do is every day you can chart yourself. This is what we have with our asthma management plan. And you take a deep breath, you stand up, of course, you take a deep breath, and you blow as hard as you can. Now, over time, here you would see that you can chart yourself as to how you're breathing. So on a good day, maybe I can bring it up to here when I blow. And then I can get a level of when I am possibly having an attack. So it would only come here. So I know, yes, earlier this week I was here. Then during midweek, let's see, I possibly did here. And then it is here. So I know green, I'm fine. Amber, I need to take my treatment, especially my preventer inhaler. And red, I definitely need to see a physician to help me, because maybe I need to be nebulized.
Well, thank you so much for all of that information. I know that will definitely help persons, especially asthmatic or caregivers, to help better assist with the management of asthma.
Sorry, and Ms. Let, all of these here are available in the British Virgin Islands. So it's not hard to access them.
In terms of cost, is it economical?
It is economical when you look at the cost of a life, yes.
I love that answer. Now, I know there's been some controversy in terms of using the open mouth technique versus closed, which is actually better, and how do we do that?
Okay, the open mouth technique. The closed mouth technique is when you put it in and you close your lips around. Now, what is being discovered is that individuals were developing thrush at the back of the throat, because it's closed mouth, so it is hitting you at the back of the propellant is hitting you at the back of the throat. Now with the open mouth technique, if you're an adult and you're using it, you can stay 1 to 2 spaces away and inhale. So we found out that the frequency of development of thrush was not occurring, and you were getting just as much as an effective treatment as the closed mouth technique. So that one is being promoted, because of course we don't want people developing thrush. And also, even in the open mouth technique, after using any inhaler, you should gargle, just to prevent the development of thrush, yes.
Okay. Now, you shared with us some vital information. Before we close the program, I wanted you to leave us with some of the key messages that you want us to really pay attention to and follow as asthmatics and caregivers for persons who may have asthma, to ensure that we have a better management strategy in place and we are all safer at the end of the day.
Okay. I would like to reiterate, asthma is a very serious condition. Now, there are individuals who I have heard saying, I have grown out of my asthma. And we need to be very careful, because it is a chronic condition. And if exposed, even if you haven't had an attack for a long time, if exposed to one of the triggers, it can occur. Now, that person, because they have grown out of asthma, may not be walking with their inhaler. And that is a danger. So once you have been diagnosed with asthma, you should always walk with your inhaler to church, to school, to play. And to play brings me to the PE sessions for our children in school. asthmatic children and even adults who exercise should use the blue inhaler, which is the reliever inhaler, 15 minutes before activity. Because as you exercise in PE, or you're exercising on your treadmill or whatever, you increase your breathing of the cold air in your lungs. And remember, I said cold air is a trigger. So get in the habit, because I don't think that most of our children are using the inhalers before PE. So get in the habit of using your inhaler before the PE session, 15 minutes, or even exercising, so that you can prevent the bronchioles from going into spasms. If we have furry friends, we need to vacuum them often and enclose them in a bag. We need to wash our bed linens as frequently as we can, especially in hot water. Dry them in sunlight, because that will keep our dust mites. We can vacuum our mattress or even buy the enclosure, and we can do that and change those periodically. Okay, we can try to reduce our cockroach drop-ins by cleaning regularly. Vacuuming. Carpets are another thing that I know we like our carpets. We like to walk on them. They are warm, they're soft and everything. But they hold a lot of dust. They hold a lot of dust mites. They hold a lot of drop-ins when the cockroaches may be out at night or whatever. So we may need to think on getting rid of carpets and putting tiles in our floor, which can be regularly steam cleaned and kept in a more healthy environment and have the air much better for breathing.
Well, thank you so much again, Mrs. Smith, for this wonderful interview. And I hope that our listening audience, our viewing audience, really take to heart some of the things that you've said today, which will help us overall to reduce any occurrences related to asthma.
Yes, Ms. Natasha Letson, and thank you for having me.
Not a problem at all. Thank you for tuning into this special GIS feature, where we went in depth with asthma management and shared information that, if used and applied, can help with the overall management of asthma. We encourage persons affected by this disease to use the tips and various strategies to lower your risk to things that would trigger an attack, as well as ways to effectively manage any onset. We are reminding you that this program is one of 4 that will look at pharmaceuticals and what we all should know. Remember, knowledge is power, but the application of knowledge saves lives. Reporting for the Ministry of Health and Social Development, and Public Health Communication Specialist Natasha Letson, saying thanks for tuning in. Do enjoy your week.